today with Laurie Edwards, and she is the author of a book called Life Disrupted. She also has another book coming out in April of 2013, and we'll talk to her about that later. But she is a writer, a professor, and a mom. And she also lives with some chronic conditions. So thank you so much for being here with us, Laurie, today. I know that there'll be a lot of moms out there who are excited to hear from you, as well as those people who are considering starting a family and wondering what exactly it's all about. So we're happy that you're here with us today.
Thank you. I'm thrilled to be here and I guess to be able to be talking about this stuff. So definitely a worthwhile conversation.
Now, if someone has a chronic illness, obviously there's concerns sometimes about starting a family. So when you are a patient considering starting a family, what are some of the most important questions you think are to ask?
Okay, great. There are a few, and I think that there's one sort of overarching global question that I think really transcends whatever disease you have, whatever symptoms you have, whatever medications you take, whatever your circumstances are. And that's for the idea of if you can get pregnant, should you? Right? And that's sort of a question that was posed to me from a reproductive endocrinologist in sort of a rhetorical way. She was saying, in this day and age, I can get most people pregnant, but the question isn't really, can you get pregnant, but should you? So assuming that you can get pregnant, which is a question that a lot of people have a lot of different answers to, should you? And the things that go into that are sort of, do you have the support that you need? Do you have sort of this idea of it takes a village? Do you have people that will be able to help you? Do you have a medical team? And we'll talk about the specifics of those types of things in a minute. But does it make sense for you in your family? And it's a really intensely personal question. And unfortunately, there's a lot of white noise when you're chronically ill and you're thinking about starting a family. There are relatives who have an opinion, and there are people who don't even know you who have an opinion and are unfortunately all too eager to jump in and tell you what that is. There are a lot of naysayers. Personally, I've had people say, well, aren't you worried you're going to give a kid your disease? Why would you have a child? Or, you're sick. What are you thinking having a child? How are you going to be able to take care of him or her if you have days where you have trouble taking care of yourself? And I know I'm not alone. I know lots of people through the internet and in person who've had similar conversations. And at the end of the day, my husband and I said, we sort of just have to build a cocoon and drown out all that white noise and make a decision for ourselves. And then that can be obviously really challenging. But in order to make those kinds of decisions, the questions that you really need to ask are, first of all, disease management, and your disease would be like if you were to become pregnant. So you need to really understand how your symptoms might impact a growing baby. And for me, that was a really big one because I have respiratory conditions, and there's a certain threshold of oxygenation that is really dangerous for a growing baby. So that was something personally that I had to really consider. And what would an infection in my lungs do if I were pregnant? What would it do to me? What would it do to the baby? So, of course, it varies from person to person what those symptoms are going to be. And then also what impact your medications will have. That's a huge one to consider, too. I know that there are people with certain conditions, thinking rheumatoid arthritis and lupus, for example, for some of the drugs that they use to manage their inflammation, they wouldn't be able to take while pregnant. So that's a really big consideration. For me, there are certain antibiotics that I really depend on that I wouldn't be able to take while pregnant. So knowing those kinds of things are extremely important because you want to know what's going to happen to your body, and as much as you can predict, because obviously all pregnancy is inherently unpredictable, and also what your medications might do, and then in which case what alternatives might you have if you have to come off some of your medications. So the other big question alongside, well, how is my disease going to impact pregnancy, and how is pregnancy going to impact my disease? You absolutely need to know the answers to that. Is also, who is my medical team going to be? And that's an enormous pre-planning item to do. And I would say, for me and my husband, it took us probably a year of gathering research on our own, gathering insights from other people who have chronic illness through my blog and just in the general social media community, but also working with specialists. So talking with my lung specialist, we made separate appointments for consults just to talk about what pregnancy might do, talk to reproductive endocrinologists, and the most important people were the maternal fetal medicine high-risk team. And we met with them several times before we even considered getting pregnant. And they were the best ones in terms of what we could expect with different outcomes that say premature, what a baby born at 30 weeks might face versus 34 weeks versus, say, 26 weeks. Because all of those considerations are really important. If you know you have a high-risk pregnancy and you have a higher risk of, say, a premature birth, you absolutely want to go into this with your eyes wide open and know what your child might face. It's the important decision you'll ever make for that child, so you really need to know what you're looking at. And so establishing a team is really important, and making sure that they communicate with each other makes such a difference. So, you want to feel you can trust your doctors. You want to feel you can ask them as many questions as you have. And you want to make sure that they're other. Absolutely. For me, it was really comforting to go into a fetal medicine consult and know that my doctor had already spoken with my lung doctor. They'd already discussed what medications I would be able to take and would not be able to take, all before I ever walked in the room. And, that sort of collaboration was key to my pregnancy, which was high risk and which did have a lot of appointments and a lot of challenges, as you might say. Even literally in the hospital room, I had general medicine consulting with fetal medicine, consulting with respiratory when I was an inpatient, all in the same physical room. They were having a conversation about the best way to treat me. So you really want to make sure you've asked yourself, who do I need to talk to? What specialist do I need? If your doctor isn't giving you the answers you need, then find somebody who will. And one really good way to do that, and Lisa, this is something you alluded to in your opening, is to seek out people who might have something similar to you and who have been, and that, I have a rare disease, that's a little bit more challenging. There aren't that many people who have gone through successful pregnancies, and there isn't a lot of data out there. So it was a little bit more challenging, but I do absolutely think the internet was a huge help for me because I was able to connect with a few other patients and say, hey, what was it really like? The doctors have given me these predictions. They've told me what I could expect, but what was it like living through it? And that's huge too. So it's all this information gathering that's so critical, and it has to be a full circle. It has to be from doctors, from specialists, from friends and family, if that's something that you're comfortable with, and from other patients who have walked in similar journeys. So there are definitely some universals to chronic illness and pregnancy, but sometimes if you really need those specifics, what is it like to feel like you can't breathe when you're pregnant, when you already feel like that, for example, then really do seek out the community. But in the end, it's really hard. And it's something that once you become a parent, you're always faced with, which is getting all the information, but then making the decision that's the best for you and your family and your child. Get all the information you need, but realize at the end it is personal. And there are many, many ways to grow a family and to be a parent. And pregnancy is just one of many wonderful options out there. So at the same time, it's really important to get all this information. It's also really important to stay true to yourself and to make a decision that's best for you and not what your mother wants or your friend wants or things like that. It is intensely personal.
When you're not pregnant yet and you're looking at your options and collecting that very crucial medical team, I've heard many stories and I've experienced them myself where someone on your potential team doesn't want you to get pregnant and thinks it's a ridiculous idea. And that may be a very personal opinion for that particular physician. Do you think there's definitely a time to listen to them and other times not to, and that when you're collecting that medical team, you might have to go out of someone that is a doctor for you and find someone outside that will support you in your pregnancy?
That's a fabulous question, and unfortunately, it is true. There are people who will say these things. We had a doctor say to us once, with all the numbers and the information that you do have, why would you ever carry a child? Go get a gestational carrier, or go adopt, go do something. Why would you ever consider it? And I recognized from her position and what her role which was to bring a healthy, living baby into the world, right? I got what she was saying, but the way she said it, and the manner in which she said it, she wasn't somebody that we ended up really taking into consideration. We heard her concerns, but we had done so much research that we understood what we were facing, and more importantly, we understood what we could do to give ourselves the best outcome possible. And when that happened to us, we turned to someone that we trusted really implicitly, and that was my lung doctor, who I have a wonderful relationship with. And we basically said, this is what's been said. Are we crazy for thinking we can pull this off? And he said, if you're just looking at numbers, yes, there are other options that are safer for you. But it isn't just about numbers. There's so much else that goes into a decision like this, and it's social, and it's spiritual, and it's financial, and it's all these things that you can't reduce down to a single statistic. And so all those need to go into play. So sometimes, you do need to find someone who is receptive, but at the same time, I think it's important to acknowledge why people might say these things if they're medical and they're saying it. Obviously, no one has the intention of trying to make you feel bad or rude or anything like that. They're coming from a place of research and statistics. So I think that I could hear her and understand her concern, but also realize that in the end it wasn't her call. But I could get to that place because I had spent years doing research and had lined myself up with people who said, these are the steps we need to take for you personally to have the best outcome possible. And I felt confident enough at the time that we would be able to do that I could hear her and hear what she was saying, but also realize that, there was another way. The last sort of big picture kind of question that you really need to think about when you're considering starting a family is financial. Obviously, being sick is expensive, but you really need to have a good sense of what your health insurance is and what they will cover. And also, as I've said a couple times, there are many ways to have a family, and getting pregnant is one of many, but they're all expensive. So if you are someone who is thinking about, say, a gestational carrier because you feel like that might be a safer option for you or your child, if you're thinking about using or going through adoption because you think that's the best way for your family to grow, all the same things I already said apply. Obviously, you want to fact find, you want to talk to people who have done it, all those things. Especially, I've had a lot of people ask me questions about adoption and sort of what do you do if you have a chronic illness? Do you think that people won't select you? All of those things. So there's a lot of research that you need to find for that. But also, too, how much is all this going to cost? And it's unfortunate that needs to be a consideration, but for most people, I assume that it does, and it really depends on your health insurance, depends on your state. I live in Massachusetts, where we have a healthcare mandate that, for example, will pay for infertility, or most parts of it, maybe not every single thing. It really depends, I guess, on what your diagnosis and your needs are. But we'll pay for a large portion of infertility. So if you are looking at different options for family building, and you're comparing, well, how much would say IVF cost you if you needed to use that? What is the adoption tax credit? Do you know about all of that? And then again, of course, what does your insurance cover and what won't it, even if it doesn't have some sort of a mandate? So those are factions that, obviously go into this huge global of if you can get pregnant, should you? And like everything else in this, take your time, find out the facts, get people on the phone, ask questions, talk to people who have done it. It took us years and years and years to have a family, and part of that time was really spent looking up every option, finding out every single thing we could get our hands on, talking to people in the flesh who had been where we were, people who had adopted, people who had used gestational carriers, people who had had high-risk pregnancies. And you absolutely need to do that. But also, the financial equation is important too, because you want to make sure that you put yourself in the position where once you have this child, you're able to provide for him or her too. So again, these are all the reasons that make this the most intense and personal decision that you'll ever make as a family. Again, you just want to make sure that you've done everything you can to give yourselves the facts you need to make a decision for your family.
Now, most of us who live with a chronic illness, the odds are if we do get pregnant, it will be considered, medically speaking, a high-risk pregnancy. So what are some of the strategies that you would recommend people remember, put into place, that kind of thing, when you're talking about a very complex pregnancy?
As we all know, women who are pregnant have a lot of things they need to worry about and think about. With how much water are you drinking, what foods can you eat or should you avoid, how much exercise can you get. But women with chronic illness have all those concerns, but then so many more, right? And so I think it's really important to recognize the need for flexibility, that you're always going to be balancing, and it's going to be such a fine balance between what you need to do for your body and your conditions versus what is best for the baby. And sometimes those things are really in tension with one another. So it's really important to keep in mind that what works for today might not work next week or next month. And that's really where the value of having a medical team who communicate with each other and with whom you're comfortable communicating comes into play. Just to give an example, for me, moving around and getting exercise is really important. It moves the mucus in my lungs. It makes it easier for me to clear secretions, and that makes infection less likely. It's all around. It's really important for me to stay active. And so I was very active up until about my 28th week of pregnancy. And then I came down with, or I manifested, I guess, pregnancy-induced hypertension. So I needed to go on bed rest. So those were two completely conflicting things. The need to keep my lungs moving so that I got more air and my baby got more air, versus the need to stay still, because any movement, even sitting up, raised my blood pressure really high. So it's a question of competing needs there. Yes, I needed oxygen, but the more immediate risk of, say, uncontrolled high blood pressure is a stroke, right? So I had to, at that point, readjust. Say, okay, right now, the most important thing is keeping my blood pressure under control, taking the blood pressure medication, and doing everything I can to avoid full-on preeclampsia. My lungs are going to have to take the back seat right now. And so that's a give and take, and that's obviously a very specific example to me. That kind of give and take is something that you should sort of expect and hope that it doesn't happen, but expect that what worked in the first trimester might not work in the second. What helped you in the second trimester might not be an option in the third trimester. So again, just being very aware that things can change, staying on top of things, and communicating are really important. From a more pragmatic standpoint, high-risk pregnancies involve a lot of doctor visits, a lot of appointments. So there's the logistics of that. Do you know ahead of time? You should know as much about your health insurance and what is covered and what is not as possible. And the same with your employer, short-term disability, anything like that. You should have all that lined up and already know that. But then from a pragmatic standpoint, what's going to happen if you end up needing to go for twice-a-week visits for the entire third trimester? Or what if you get admitted? Or all those types of things. So, you've heard the saying, plan for the worst and hope for the best, and that's really true. So when you're thinking about it and you're living it, so hopefully you won't need a lot of admissions. Hopefully you won't need a non-stress test every other day. But what if you do? Then you do what you need to do for your baby, obviously, but you sort of need to establish a network. So are there people that might be able to drive you? If you need an appointment and you're on bed rest and you're not supposed to drive, do you have people lined up that could do that? What about your employer? How flexible are they with leaving early for appointments or coming in late? How close do you live and work to your doctor in your hospital? Will it take you an hour and a half to get from work to an appointment? What if you're in an emergency? So all these sorts of questions to ask, but then when you're actually living it, strategy is to know if you've done your work and you sort of are prepared for the unpredictable and hope that it doesn't come. So in my case, we really did have a really good outcome. Both my daughter and I did much better than I ever thought possible. We had a lot of appointments. We had a lot of bumps in the road. I was admitted to labor and delivery probably 9 times before I actually gave birth. And I had no idea what to do with me there because I don't see a lot of rare genetic lung disease patients needing oxygen. I had appointments once a week, twice a week, 3 times a week. I had more ultrasounds than I could probably wallpaper a room with pictures from. And all of that took logistics. It took planning. So it's sort of, what are you going to do? What kind of relationship do you have with your boss, with your employer? Do you have family close by that are going to help you? Again, what if you need a ride? What if you just need somebody to come let your dog out, right? Because you unexpectedly were admitted and ended up in the hospital for 2 days for a half an hour checkup. Excuse me, and that happened to us. So sort of, from a health standpoint, you have this idea of being really flexible and knowing that balance is always going to shift, but from sort of the pragmatic daily living aspect, sort of know that things could get really intense and that you could be pulled away from your everyday life often, and sort of be prepared for that and that unpredictability. Obviously, you don't want to think that anything unexpected is going to come up, but it can in any pregnancy. So know that it's probably likely that it'll happen to you. And then there's also the idea of, every mother wants a safe delivery, right? And I know that there are a lot of people who have birth plans, and, my plan was that I didn't have a plan, to be honest with you. My goal was to just get this baby into the world safely, however that happened. And, that can be really challenging, too, because you have this idea of an ideal birth, and when you have chronic illness, hopefully you'll have that wonderful ideal experience, but again, there are a lot of sort of competing needs and priorities, and at the end of the day, in the same way that you need to be really prepared to shift gears from a treatment standpoint throughout the pregnancy, I would say in that stretch when you actually are close to delivering and in the delivery stage, really important to be flexible and switch gears as the situation changes, because that can happen really quickly. And again, that's where it's really important that you feel like you can trust your healthcare providers and you can communicate, and that you all have the same best interests and you all have the same understanding of your conditions. And that was a really important thing for me, because as I mentioned a couple minutes ago, a lot of healthcare workers on the labor and delivery floor obviously were experts in keeping babies safe and bringing them into the world, but had no idea what to do with my condition. They'd never even heard of one of them, primary ciliary dyskinesia, which is a little bit like cystic fibrosis for some background. So again, it's sort of making sure you have people who are in your corner, who advocate for you, who know what you want, and that you trust when they say, listen, I know, we agreed that we were going to try to avoid doing procedure X, but now we're here and we need to do it. Feeling like you're comfortable switching gears like that is really important.
Now, obviously, babies and children have a lot of needs, and we're their sole care provider. And so, I first had my son, I would forget to take medications at a certain time of the day. And I remembered, I thought I have to make a conscious decision to get organized here, because if I forget my meds and I'm a disaster, I'm going to be no good for him. On the other hand, I started drinking a ton of water and had some really healthy habits, because since I adopted, he was taking formula, and I always had water with me to mix up his formula. So I started carrying massive amounts of water in the trunk of the car, and I just started swigging it. So there were some habits I formed that were good, that I would not have done on my own. So what are some ways that you see parents being able to manage and meet the needs of both themselves and their kids?
This is something that I think is really difficult, and it changes every day. It's something that I probably struggle with the most. You know, there's that saying, especially when you start talking about parenting and chronic illness, there's that saying, it's sort of like the airplane and oxygen mask, where it's sort of counterintuitive, but you put the oxygen mask on first so that you can then help your kid, because you're no help to your kid if you're passed out, so you're not oxygen, right? That makes so much sense in theory. It absolutely does, but in practice, it's really hard to make those negotiations. I sort of think of it as triage. You know, that whole process when you go to the ER and they figure out, well, who's in the most serious shape, who needs to be seen first, who can wait a couple hours. It's kind of like that, you know, and especially when babies are newborns and they're very young infants. Especially, you know, you're there every couple of hours. You know, you're their everything, you're their world, and so a hungry newborn doesn't care if you don't feel good, right? They really just don't. So one thing I always kept in mind is that, you know, and this is not specific to chronic illness, it's all parents, right? That the minute this child comes into your life, regardless of how, right, everything becomes about that child, right? And that's what parenting is. And so it's sort of learning when to negotiate, when to pull back, when to push yourself, when to ignore. You know, for some examples, when my daughter was very young, I had chest physical therapy every day, where I have physical therapists come to my house and clap my lungs and shake things loose, as it were. And it takes about half an hour. It's really important. It's preventive therapy for me. It keeps me out of the hospital. It allows me to be productive and go to work and do all that. But it was always at dinner time, and my husband was working, and especially when I was on maternity leave, and it was always at this terrible time of day where my daughter needed me. She just wanted to be held. So it was always so hard to put her in her little bouncy chair or her exerciser when she was a little bit older, and I would have her right there, but she would want me, and I would know that, and I wouldn't be able to explain to her that I would be with her really soon, but what I was doing I really needed to do for both of us. And I think too about, say, the diabetic who needs to stop and check her blood sugar or take insulin or things like that. You know, in the moment, the emotion of it makes it really hard to be able to say intellectually, I need to just get through chest PT. You know, she's not in danger. She's not throwing up. She's just a baby who wants her mama, and that's understandable. The sooner I wrap this up, the better I am able to be her mother and just get through it. So that was a really crystal example for me when she was really young. And, you know, it goes in flow. Sometimes it's really easy, especially if you're having symptoms and they're not as bad and you're feeling pretty good, then it's real easy to make it, okay, mom first, patient back burner. I do admit that I struggle with it quite a bit, and I'm more prone to just pushing through until I kind of reach that crisis moment, or almost do. And I think for me, last spring there was a moment where I was really, really sick, had a lot of infections, they just weren't going away, I wasn't clearing them, and I was about to be hospitalized. And I kind of talked my doctors out of it, but I said to myself, whoa, like, this is crazy. I might not be that, I'm not going to be any good to her if I'm not here. And I kept saying, oh, I don't want to go down, I don't want to take a nap, I don't want to do this, I want to be there for the baby, and then I have work, and et cetera, et cetera. But I was like, wait a minute, if I'm an inpatient, then I'm not with her at all, and that's way worse. So it is sort of a daily triage. And there are going to be times where you absolutely should and need to address your health. Healthy, happy mother makes for a healthy, happy baby. But again, like everything else with all of this, those things are sometimes in tension, I guess is the right way to say it, with each other. And it can be really, really difficult. So again, sort of be prepared to be flexible. You know, my daughter had some health problems, nothing too serious, but disconcerting nonetheless when she was younger. And so there would be times where I was really sick, but she was sicker. And so she needed my nebulizer, and so she had it before I had it. And obviously in cases where your child is sick, if you're physically able, you know, your needs come second. But then again, you don't want to ignore yourself to the point where then you are in the hospital, or you are, for example, in, a very bad relapse where you're thinking if you keep pushing it like this, you're going to be on the couch for weeks, when maybe if you just stop and ask for help, you'll do much better. That's where it's really important to really make sure that you have a village, as it were. I talked about this a lot on my blog, and I got a lot of feedback from people, and the real common refrain was, it takes a village. So an important part of being able to meet your baby's needs and your young child's needs and your children's needs is knowing when to ask for help. And that's really hard, but I think if you sort of have this village set up beforehand, and you know that there are friends or family that you can call on, that can come help you, that's important. If you have to feel confident enough to ask for help, and that can be really hard. Absolutely, but at the end of the day, it is true. You're no good to your baby if you can't even be with him or her because you're too sick, right? You do want to make sure you keep yourself healthy enough so that you can be the kind of parent that you want to be. And I think that's one of the biggest fears women who are thinking about having children with chronic illness, they've shared with me, is that, how am I going to do this? How am I going to pull this off and make this balance and be there for my child, when sometimes I don't feel like I can even be there for me. So, at the end of the day, children need to feel loved and valued and respected. And as my daughter gets older and older, I'm realizing she's not focusing on or maybe even aware of what I maybe can't do, because what we're doing, we're living. So you brought up a great example of, well, you weren't able to play on the floor because of what it did to your joints, but so you did something else and your child learned something different. So, I think that people with chronic illness have learned to be masters of compensating and adapting and adjusting, and I think that those skills come in really handy when you are a parent. So yes, absolutely there are limitations you might have, and my limitations are going to be different than yours. But knowing that, you regroup and you do what you can do. Just like you have done every day of your life that you've been a patient. You make do with what you have and you make the best of it. And, your children will roll along with you. And so if you're happy and you're engaged, are they going to remember or care that you weren't necessarily rolling around on the ground or doing boot camp mommy workouts with some of the other mothers? No, they're going to remember, were you there? Were you with them? Were you engaged? Were you giving them love? Were you responding to their needs in the best way that you could? And that's what the most important thing is. There's enough guilt in the world, and there's enough guilt that comes with motherhood. I think you need, again, you've done a great job if you've gotten this far, so trust those instincts and do what's right for your kid and you, and try to drown everybody else out if you can.
Laurie, tell us a little bit about your website and what people can find there, and also about your books. I know I really enjoyed Life Disrupted, and I've said many times I wish it had existed when I was in my 20s and 30s. And you have a new book coming out, too, called In the Kingdom of the Sick. So tell us a little bit about those things.
Sure. Well, I'm very excited. This is the first time I've actually spoken about my new book, which I should say was due originally the same day that my daughter was. So it has been quite a journey of getting that done with a baby. So I'm very excited that I have reached the end of that stage. But to backtrack a little, I started writing at my blog, which is chronicdose.com, about 6 years ago. And I started writing because I felt there was this big void in what was out there for younger adults with chronic illness. There just weren't a lot of people targeting people in their 20s, 30s, 40s, sort of this idea of the chronically ill patient as an 80-year-old, right, for example. So that's why I started blogging, and then my book came out of sort of that audience, right? So Life Disrupted, my first book, is Life Disrupted, Getting Real About Chronic Illness in Your 20s and 30s. So it's all about sort of those major life stages that we face as young adults, so relationships, careers, marriage, all when you have chronic illness. So getting through college, all those kinds of things. So what I blog about at chronicdose.com now includes parenting, of course, infertility, pregnancy, all that. But the core of it is still chronic illness and navigating everyday life. And being productive in the face of chronic illness. So I have many different conditions. So I tend, as a writer and an advocate, to focus on the universals of chronic illness, not specific diseases or symptoms. So I'm not as interested necessarily in why I can't get to work one day, for example, or what symptoms are really bothering me, but sort of how do we navigate talking to our bosses when we realize we have to disclose that we're chronically ill. It's a disclosure that most people struggle with. So that's an example of the kind of things that I'm interested in and write about. My second book is much more research-based and less prescriptive. Life Disrupted was sort of stories of patients and my own stories too, and sort of this is what we did and these are strategies for getting through these big life stages. But In the Kingdom of the Sick is a social history of chronic disease in America. So, and In the Kingdom of the Sick is actually a part of a Susan Sontag quote from Illness as a Metaphor. So it is looking primarily at America post World War II on up to current day right now. How has the definition of chronic illness changed? What does that mean for patients? How has patient advocacy changed? How have various social justice movements, civil rights movements, disability rights movements, how have they all impacted the experience of living with chronic illness today? So I'm really excited about it. It's coming out in April of 2013. And I'll have a lot more to say about it and a lot more information on my blog. And this month, actually, I'll be relaunching and totally redoing my site. So I'm excited to have that ready and share that too. So it's been a few years. It needs a facelift. So I'm a professor, so I think in semesters, so September seems like a great time for a fresh look. So definitely stay tuned for that too.
Well, I want to thank you so much for being here with us today and just sharing your journey.
Thank you so much.
Thank you, Laurie.